Hi, my name is Diego Rivero. Thank you for joining back on my second episode of my podcast. And on the first episode of my podcast, I was talking about GAD, which is also called Generalized Anxiety Disorder. And when I last left off on what are the symptoms of generalized anxiety disorder, they are lack of sleep, there's difficulty concentrating, fatigue, excessive worrying, muscle tension, relentlessness. These are all things that, and ultimately, even one of these things, the biggest one, in my opinion at least, is sleep disturbance. It's the lack of sleep. Because if we're not getting into if we're not resting properly, our minds, our body are not resetting for the next day to properly function. Same thing as muscle tension, fatigue. If we're too fatigued, we're not gonna perform the way we're supposed to perform, whether it's at work, in our family life, to wife, husband, boyfriend, girlfriend, kids. We're not gonna perform. We're not gonna be how we're supposed to be or act the way we're supposed to act. And by doing that, we're only gonna increase our anxiety because that only stresses us out. That only stresses us out even more, especially with people with generalized anxiety disorder. That will only make them more anxious, bring them more stress, more at ease, and more symptoms. More, it will only make them feel worse. So, on on this episode, I'm gonna continuing about GAD. So, what causes generalized anxiety disorders? So, we're not too entirely understood of how it is caused, but there are some cases, there are some ideas that it could be a combination of genetic, environmental, and psychological factors. It's thought that those are the ones that contribute to its development. So, first, I'm going to be going over our genetics. I'm going to be going more into details. So, genetics. So, there are studies demonstrate that GAD shows genetic inheritance patterns because it frequently appears among family members. The presence of an anxiety disorder in close relatives increases a person's likelihood of developing GAD. The second one is environmental stressors. So, experiencing traumatic childhood events or abuse, along with the death of a loved one or financial struggles, raises the chances of developing GAD. The disorder can trigger or worsen because of ongoing stress factors, which include pressures, pressure at work, and conflicts between partners. Number three, the third one is cognitive patterns. Individuals suffering with GAD commonly display constantly I'm sorry cognitive patterns. Individuals suffering from GAD commonly display maladaptive thinking patterns, including catastrophizing and threatening overestimations. People who anticipate negative outcomes for nearly any event tend to develop and sustain anxiety through these thought patterns. The fourth one is brain chemistry. Scientists believe that imbalanced neurotransmitters, the brain signals transmitting chemicals, contribute to the development of anxiety disorders. Research identifies serotonin, dopamine, and gamma aminobutyric acid, also called GABA, as key neurotransmitters that regulate anxiety. So, what are some treatments of it? So, thankfully, it is treatable. It can get better. So, I'm gonna be going now on how to treat it, for how to get better. How do we get better with generalized anxiety disorder? So, the first one is cognitive behavior therapy, which is also called CBT. So, this treatment method stands as the primary choice for generalized anxiety disorder. CBT, this treatment method enables people to recognize and dispute unreasonable thoughts which trigger anxiety while introducing more accurate and balanced thinking patterns. CBT includes training patients to use coping strategies which help control physical symptoms of anxiety through relaxation techniques and mindfulness exercises. Number 2, lifestyle changes. People who have GAD will experience positive effects from making specific lifestyle changes, which help them relax and improve their general well being along with their current treatment methods. Engaging in physical exercise regularly, along maintaining a balanced diet and proper sleep patterns, while practicing mindfulness through meditation, reduces stress and anxiety. So, exercise is amazing for mental health. It's one of the best things we can do for our mental health. Not only if that you feel good, but if you feel good, not only that you feel good, but you just feel happy because exercise releases certain chemicals in our mind that make you happy, that make you feel good, that make you feel alive, that make you want to do more with your day. So that's why I'm a big believer in exercise, because exercise only helps every aspect in your life. So, what are some medications that you could take if you feel that the lifestyle changes aren't helping you or the CBT therapy isn't benefiting you? So, there's some medications for that actually. So, the first one is selective serotonin reuptake inhibitors, which is also called SSRIs. The prescription of antidepressants like fluoxetine and sertraline for anxiety disorder stems from their capability to elevate serotonin levels, which then enhances mood while decreasing anxiety. Number 2, serotonin norepinephrine reuptake inhibitors. They are also used to treat JD by balancing serotonin and norepinephrine levels in the brain. Number 3, benzodiazepines. Doctors prescribe quick-acting drugs like diazepam and alprazolam for temporary relief from severe anxiety symptoms. The potential of the potential for dependency makes benzodiazepines a medication that healthcare providers prescribe cautiously because they're very addictive. Once you feel it, it's very hard to get off it, and that's why, like it says here, that a lot of people in the healthcare are very cautious, are very. This is usually the last resort. This medication is the last resort. It's very addicting. Yes, it helps you. You do feel a difference, but it's also very addictive. You start feeling that you need it, and that's not good. We're not trying to. We're trying to solve the issue. We're not to solve the problem. We're not trying to push it down. We're not trying to rely on something to make it better. We want to make it better through try as hard as possible at least to not rely on such a strong medication like this. So, a case study that I have a case study over a girl named Sarah. So Sarah, who has faced anxiety since her young adult as a 32-year-old woman, provide an example of the effects of GAD. Sarah experienced anxiety beginning in her late teens, but waited until her mid 20s to seek treatment. When her constant worrying began affecting both her professional and personal life, Sarah frequently worried about work deadlines and her health and her family's welfare, but she had no reason to worry. Her racing thoughts disrupted her sleep, which resulted in physical tension and fatigue. Her anxiety caused her to avoid social gatherings and isolate herself from friends, which worsened her feelings of loneliness and distress. After seeking treatment, Sarah received a generalized anxiety disorder diagnosis. Sarah acquired new anxiety management techniques and learned to fight against catastrophic thinking throughout her CBT therapy sessions. The doctor prescribed an SSR medication to manage her symptoms. The passage of time brought symptom relief to Sarah, giving her the ability to take control of her life again, which is amazing because she was a slave to her anxiety. She was controlled by her anxiety. She was able to feel that she got her life back because of it. So, kind of a conclusion and overview of this. The importance of generalized anxiety disorder extends beyond measure. A large segment of the population experiences this condition, and gaining knowledge about it plays a crucial role in developing an empathetic and knowledgeable mental health strategy. People with generalized anxiety disorder must receive correct diagnosis and treatment to effectively control their symptoms and enhance their life quality. Increased understanding of GED enables people to gain necessary support for anxiety management to achieve the most fulfilling life they can possibly have. Thank you for hearing me. Thank you for being interested in my topic, and I'll be making two more in the near future. Thank you so much.